Good evening.
Good evening, sir.
Good evening, sir.
Good evening. I'm here. Yes, I
People
hope.
General, you're welcome.
My chairman.
Yes, People General. Thank you, sir.
Here we are.
You're welcome on board,
Thank
sir.
you. Thank you very much. So we're on course.
Good evening, Professor Ogunbiyi.
Is that my president?
Good evening, sir. And it says you're
Good evening, my president, sir.
Yes.
We are very delighted to have you before us.
Thank you.
And thank you for the invitation.
Thank you, Prof.
Thank you,
Prof.
Faculty Chair, good evening.
Good evening, sir.
Evening. Chairman, CME, good evening.
Good evening, sir.
Evening. Chairman, CME.
President, sir. Can we kindly give them 5 minutes? Sorry, sir. People are still joining. We have 52. So I'm counting, please, sir. We start 5 minutes after. Sir?
Chairman.
College President, sir. Other principal officers here present. The chairman of CME, National Postgraduate Medical College. My senior colleagues and colleagues. We are all welcome to the maiden edition of the webinar of National Postgraduate Medical College. As we are all aware that the National Postgraduate Medical College is mandated to accredit clinical training centers, and part of its own responsibility is for training. We have various ways we are training our residents from the teaching hospitals and also our update courses and the trainers, TOT. However, the current management headed by Professor Dr. Ikemefuna that we should commence a bi-monthly webinar whereby all the faculties, the 17 faculties, 18 faculties will come one after the other. Happen to be in anesthesia as the first faculty, we are going to present the first webinar. And as Faculty of Anaesthesia, we are privileged to be the pioneer, the maiden one. We hereby welcome everyone to this first meeting webinar, and we hope that this webinar will be interesting. We, the Faculty of Anaesthesia, choose a topic that invariably will be applicable to all the faculties. That's anesthesia and AI, artificial intelligence. It's just what we say. If it's anesthesia and AI, you can say anesthesia and data surgery, data surgery and AI. You can also equally say pediatrics and AI. So invariably, whatever we are going, the guest lecturer is going to speak, you can also put it in your own practice. So we try to choose something that actually will be universal to all the faculties. I am Dr. Adamu Sadiq Abubakar. I'm a professor of anesthesia and intensive care medicine. I'm also the Vice Chancellor at Lincoln University, Kumo. I welcome you all. Later, I will introduce my guest lecturer, who is one of our senior colleagues, Faculty of Anaesthesia. However, before we do that, I will hereby welcome our college president, our able college president, the dynamic college president, to give his opening remark. Please, our college president, can you give us your opening remark before we commence this? Can you put a blessing to this webinar? Thank you, sir.
Thank you, Chairman, Faculty of Anaesthesia, and good evening to the guest lecturer, Professor Ogunbiyi, my distinguished colleagues, and this very distinguished audience. I welcome you to this bi-monthly college webinar series, which is part of our NPMCN educational program. The aim actually is to disseminate knowledge and instill our commitment to lifelong learning as a foremost postgraduate medical college in Nigeria. I expect that the college online lecture series will reshape our academic image and provide opportunities for fellows and faculties to collaborate with one another. I'm also thankful to the Continuing Medical Education Committee led by my friend Dr. Simeon Isizwe and Chairman Faculty of Anaesthesia for performing this inaugural college webinar. On behalf of Senate and Governing Board of NPMCN, I thank Professor Ogunbiyi, who is today's speaker, for accepting this invitation, even at very short notice. I invite you to sit back and listen to this lecturer, and I believe that we'll have to go home with many takeaways. I therefore formally declare this webinar series open, and we say God bless us, God bless the Federal Republic of Nigeria, and also long live the National Postgraduate Medical College of Nigeria. Over to you, Chairman, Faculty of Anaesthesia.
Thank you very much, our dynamic college president. Before I call on the guest lecturer, please permit me to give an abridged citation of our guest lecturer. Because if I say I will give this full citation, I think it's more than the lectures. Just one page, a brief version of his citation. Professor General Obashina Ogunbiyi, MNI, MBBS, Ibadan, MD, FMCA, FWACS, FIC. Professor Obashina Ogunbiyi, MNI, is a versatile healthcare researcher whose dynamism and commitment to excellence is manifested as an accomplished professional in two allied professions, both in medicine and in military services. He is presently a professor of anesthesia and critical care at the International University of Management for research interest in health system dynamics, COVID-19, and critical care medicine. He graduated with MBBS in June 1982 from the University of Ibadan, Nigeria. Obashina was granted Presidential Commission as a second lieutenant in May 1980 and rose to become a Major General in January 2012. He is a former Corps Commandant of the Nigerian Army Medical Corps before he voluntarily disengaged from the military service in December 2015. He is a subject of a graphic citation in the Millennium Edition of prestigious McGill, Who is Who in Medicine and Healthcare in the World, published in USA 2020-2021. Of the National Postgraduate Medical College, FMCA, May 1995. Also a fellow of West African College of Surgeons, WFCS, 2001, and a fellow of International College of Surgeons, FICS, 2000. He is a foundation awardee of the Doctor of Medicine, MD degree of the National Postgraduate Medical College in 2020, and also a foundation fellow of Nigerian Academy of Medicine, 2020. He was a member of the governing board of the National Postgraduate Medical College of Nigeria between 2009 and 2015, where he represented the Armed Forces Medical Service of Nigeria. He was also a member of the committee that midwifed the college's first 5-year strategic plan, 2010 to 2015. He has over 35 scientific national peer-reviewed medical journals, including the Lancet in 2025. In the late 2021, as the only African, he was invited to author a chapter in the global textbook on COVID-19, initiated by the National Institute of Health, USA. He rose in the academia to become an associate professor and the foundation head of Department of Anesthesia at the Kaduna State University, KASU, in 2014-2017. He is a member of the editorial board of the African Journal of Anesthesia and Intensive Care, and also Journal of Critical Care, published in the USA. He's a renowned medical educationist. He was an invited speaker at over 40 local and international professional from including the United Nations General Assembly G4 Alliance Symposium 2020, the World Bank IMF G4 Alliance Spring Meeting 2023, a former president of the Intensive and Critical Care Society of Nigeria 2016 to 2021. He was the first Black African to be elected as a member of the Council of the World Federation of Intensive Care and Critical Care, WFICC, 2017-2021. Professor Ogunbiyi is an alumnus of the prestigious National Institute of Policy and Strategic Studies, Kuru, which earned him MNI, of the renowned Galilee International Management Institute, Israel, 2019. He's a member of the Court of Examiners Anaesthesia of the National Postgraduate and West African College since 2021. His hobbies are traveling, meeting with new people, and he has been to 44 countries in 5 continents of the world and still counting. I hereby, with my president, sir, I hereby present my Oga, my chief. I call him People General, the only People General that to present this topic. Nobody is worth to present this topic apart from me. Sir, he's my president. It's my singular privilege to introduce my boss, Professor Obashina Ogunbiyi. Please, sir, can you present your presentation? Thank you, sir.
Thank you very much, my faculty chairman. Just a quick one there. I became an examiner of the National Postgraduate Medical College in the year 2001, not 2021, 2001, please. Thank you very much.
Thank you, sir.
Permit me, Mr. President, sir, to share my slides. The president of the National Postgraduate Medical College of Nigeria, my very good friend, Professor Anthony Kefuna, who is a distinguished pediatrician and the 24th College President. I want to say congratulations to you, sir.
Thank you. Welcome, sir.
The management of the National Postgraduate Medical College of Nigeria, especially the chairman of the CME committee, and all the faculty chairmen and chairpersons present here. My distinguished colleagues in the Faculty of Anaesthesia, and indeed distinguished participants at this maiden webinar of the National Postgraduate Medical College of Nigeria. The topic of my presentation today is artificial intelligence in anesthesia, revolutionizing perioperative care. I am still Professor Obashina Ogunbiyi, MNI, and I'm presenting this topic on behalf of the Faculty of Anaesthesia of the National Postgraduate Medical College of Nigeria. Topol is an emergist and also a molecule in a book titled Deep Medicine: How Artificial Intelligence Can Make Healthcare Human Again, which was published in 2018. He made this, and I quote, "It's going to be based on artificial intelligence." This is the academic building of the university where I am applying my grade presently, and that's the International University of Medicine in Windhoek, Namibia. Nice architectural design.
Hello, sir. We are not seeing the presentation. Please, can you share it?
Oh, all right.
I don't know if others are seeing.
No, we can't. We're not seeing.
No, we can't see.
We cannot see.
Can you see it now?
We can see now, sir.
Yes, we can see it now.
Let me go back.
Well, I think it's there now.
All right. All right. The topic, I sincerely apologize for that. The topic again of today's maiden webinar is artificial intelligence in anesthesia, revolutionizing perioperative care. I remain Obashina Ogunbiyi, retired Major General and Professor of Medicine, of Anesthesia and Intensive Care. Professor Eric Topol is an American cardiologist and Professor of Molecular Medicine. In his landmark book, published in 2019, he said, and I quote, "The convergence of human and artificial intelligence will define the future of medicine." Indeed, as earlier on mentioned by the faculty chairman of anesthesia in his introductory speech, the future of medicine, irrespective of the subspecialty or specialty of medicine, is dependent on artificial intelligence, and how we as clinicians come together, synergize with artificial intelligence will define the future of our medical practice. This, as I mentioned earlier on, is the academic block of the International University of Management, where I presently ply my trade in Windhoek, Namibia. It's my presentation objectives today is as shown on the screen. I will start by examining AI and its rationale in anesthesia. I will then highlight AI effects perioperatively. The rest are as shown on the screen. As a form of introduction, why do we have AI in anesthesia? Anesthesia has always been a data-rich specialty. From continuous physiological waveforms, when we practice it, the anesthetist functions at the intersection of complex, rapidly evolving information has depended on human pattern recognition, experience, and vigilance, capable of performing tasks that normally require human intelligence, has emerged as a transformative force in modern medicine. With us in anesthesia, AI is no longer speculative. It is increasingly embedded in our monitoring systems, decision support tools, even predictive analytics, and of course, our perioperative workflows. As we all are aware, as anesthetists, our main functions is dependent on the findings preoperatively, intraoperatively, postoperatively, and other workflows as the case may be. This presentation, therefore, is going to explore how AI is revolutionizing perioperative care of our patients. In other words, how it's enhancing safety, precision, efficiency, and of course, the outcome of the patient. I will also try and address its limitations with emphasis on ethical considerations and of course, future directions for AI in anesthesia. What then is artificial intelligence, particularly in the perioperative context? AI encompasses several overlapping domains, including machine learning, deep learning, natural language processing, and of course, computer vision. Machine learning algorithms learn from historical data to identify patterns and make predictions without explicit whatsoever. We are all aware of computerization and programming of data. Deep learning on its own It's a subset of machine learning, which uses neural networks with multiple layers of tools and devices to process very complex, high, such as we have in the various waveforms, images, and free text clinical notes. We're all aware of coming to the theater and you see the monitor, especially the multi-parameter monitors. If you check them as a surgeon or anesthetist, you will see different kinds of waveforms, ECG, heart rate, saturation, and so on and so forth. What machine learning does is to integrate all these waveforms to give us a sort of deep learning effect and interpret it to give us a good outcome. However, it's important to state that AI augments but does not replace clinical judgment. In perioperative medicine, AI systems ingest what we describe as heterogeneous data sources. This includes preoperative assessments, as I mentioned earlier on, intraoperative physiological signals, anesthetic drug dosing, surgical variables, and of course, postoperative outcomes. I have to mention here too that the promise in AI lies not merely in automation. This is very, very important, but in augmentation. In other words, it supports clinical decision-making while preserving the central role of the anesthetist. In other words, again, the anesthetists do have a role to play. Do not leave the machine to the so-called artificial intelligence. You still have a role to play. Let's now go to the preoperative applications of artificial intelligence in anesthesia. Preoperative assessment is very foundational to safe anesthesia. I mentioned this earlier on. And AI-driven risk prediction models now outperform the traditional scoring system in identifying patients at risk of adverse outcomes. This is one of the positive effects of AI preoperatively for us. Here, algorithms trained on large data sets can integrate demographic variables, co-laboratory values, imaging findings, and even on structural clinical notes to predict perioperative complications such as hypotension, respiratory failure, acute kidney injury, and even mortality preoperatively. These are all what we do when we go on our preoperative visits, at least a day to the day of operation, depending on the surgery that we're doing. So AI has a way of integrating all these variables, including demographic, and come up with an outcome which can predict even mortality of the patient, even before we go ahead to do the surgery. Unlike the conventional tools, which involves the anesthetist going to the bedside of the patient preoperatively, we now have AI models which dynamically adapts as new data become available. What am I saying here? AI-based, as I mentioned, go ahead and receive preoperative advice. Sure, if you go to most of our hospitals, we know that are to do preoperative visits. AI comes at this time, but and augment the use of power. Importantly, though, it does not replace clinical judgment. This again, rather, it offers probabilistic anesthetists tailor perioperative strategies to individual patients. This is very important to note that all it does, among other things, is to improve patient selection and plan for the surgery. Next, let's go to the effect of AI on our intraoperative process as anesthetists. That what we do mostly intraoperatively in the theater is monitoring of our patients. And this has to do with physiological monitoring and the outcome, and giving us early warning, the various early warning systems. One of the most impactful applications of AI in anesthesia is real-time physiological monitoring, which we do in the theater. And advanced algorithms can analyze something like the arterial pressure waveforms that we see. Even the ECG signals, capnography, and plethysmography. The AI can put this together to detect subtle patterns preceding clinical deterioration. And what does it do? It gives us a warning. The AI system is powered to give us early warning system, and it can predict intraoperative hypotension, for instance, minutes before it occurs. And what it does is allows us proactive intervention. Such systems move anesthesia from a reactive management, as we do presently, where all we know is when the blood pressure comes down, we could say ask for increase the blood flow, the IV fluid, or should we give drugs to activate the blood pressure to rise up. That is reactive management. However, what the AI does is to give us a proactive intervention. And this reduces, when we have hypertension, it reduces organ hypoperfusion and can lead to postoperative morbidity. Early intervention is very important to note. It gives us real-time waveform analysis that can lead to early intervention and stability of the patient. Next, let's see how the AI assists us in our drug delivery. And I will talk about this in form of the closed loop anesthesia systems, which we operate presently. The AI-enabled closed loop anesthesia delivery systems represent a paradigm shift in drug administration. They do this by continually analyzing the depth of anesthesia indices, hemodynamics, and also patient responses to the drugs being given. These systems can titrate hypnotics and even opioids with remarkable precision. In other words, the AI algorithm is a good device. Intraoperatively, it helps us in the precision titration of hypnotics and opioids, which we use intraoperatively, and very important.
drugs that should be avoided one way or the other for a particular patient, such that adverse effect like what happened in that hospital does not happen. I'm just wondering whether AI can be of good effect in predicting such drugs so that it can be avoided. Thank you very much.
Thank you, Dr. Taiwo. Because you are a pathologist, I would, you know all, you know everything. You do little, but by the time you are coming in as pathologist, you tell us all the flaws that happen to the patient, but you do little. Without having to make any particular comments on what's transpired, incidents you just made mention. Incidentally, what AI will do is that preoperatively, you will have imputed some things with respect to the patient, the demographics, what the patient is coming to do, and it will effectively tell you the outcome of such. If you remember, going by what transpired in the case you are mentioning, there was no documentation whatsoever. Patient just left, just came in through the door, straight to the X-ray room or whatever. However, let me not talk about that. So nothing, I don't want us to compare that incident, please. And AI will not tell you which drugs to use, but we as anesthetists, we know the drugs we use. What AI will tell you is it will predict the outcome of that particular surgery. It will also support you as the anesthetist in knowing what complications to expect so that you can quickly intervene to cause stability of the patient. So, well, permit me, if I'm not going to talk extrajudicially this time, AI models, there are AI models that probably will have come into place to avoid what transpired in that case.
Thank you, sir. Thank you very much, sir. Thank you, sir.
Thank you very much, sir. Thank you very much. I think this is the last question we have. Please kindly fill the attendance. We send the attendance through the Google form and also the feedback. We've sent all the forms. Please go to this thing, you see them, and then fill them for. It will not take you more than 2 minutes. I have a last question that I'll give. Amina Umar, you'll be the last person to talk, please. Time is against us. It's supposed to be 1 hour. And we have just 1 hour on dot. Amina, Dr. Amina Umar, please, can you ask your question? Can you unmute and ask your question? Unmute it. You are muted.
Yes, sir. Good evening, Prof. Good evening.
Good evening, Amina.
Very much, sir, for this wonderful presentation. I've been waiting for so long to be able to join this presentation for today. In fact, it has been sorry, sir, please, my question is
Please, we are not hearing you. Your network is.
I can't hear the question, please.
I think it's a network issue.
What did you?
Or she can type it if possible. She can type it.
What is it?
I said, what are the ethical concerns surrounding the use of AI in anesthesia, particularly regarding accountability and patient consent?
Yes, thank you very much. Yes, let me just quickly answer that. As I mentioned in my presentation, one of the things AI has done is to introduce very significant clinical and professional challenges to us as anesthetists. However, the system has some algorithms, and you can have algorithm bias, you can have challenges with data quality, and you can also have lack of transparency. There's something in AI we call the black box model in AI. This has to do with lack of transparency in the AI, different AI models, black box phenomenon. you may wish to note this. I didn't mention it in my presentation, but since you are asking about it now, please note it and go and check it later on because of our time. And what this means is that it also gives us medical legal accountability challenges, which I must say have remained unresolved till now. So as anesthetists, we have to ultimately have the responsibility for patient care. I mentioned this more than 5 times in my presentation. Because of ethics and legal issues, don't forget, you as an anesthetist, you are still ultimately responsible for the patient.
Thank you very much.
Thank you very much, sir. I think that's the last question we have. Some people are complaining that the link is not working. That's what they are complaining. So please kindly look for this, the problem with that Google form and rectify it. Thank you very much. I'm grateful to you. We are always for
Thank
us.
you.
I know the faculty is proud of you. We are always proud of you. Whenever we ask you to come and represent the faculty, you are always willing to do that. And you always participate in exams. You are a father in the faculty. You are the pillar you are one of the pillars of the faculty. We are always proud of you. Thank you very much for this nice presentation. And very educative. We are grateful. And we remain loyal. We continue from where you are doing. We can't say from where you stop because you didn't stop. So we continue to flag them. Yes, thank you, sir. So please, can I call on the chairman of CME to give his vote of thanks?
Thank you very much, the college president and the management. On behalf of the CME committee, I sincerely thank Professor Brigadier General Ogunbiyi, MNI, for a well-sized presentation on this very contemporary subject, all the way from India. Thank you very much, sir, for honoring our call and for being the maiden lecturer for this webinar. I also want to thank the college president and other members of the college management for this initiative and their support. The chairman, Faculty of Anaesthesia, has been very wonderful, and we thank you for your commitment and cooperation. Thank you very much, sir. The CME committee members, I thank you for your cooperation. I want to particularly thank Dr. Sule and the secretary, Omotola Ajayi, for all their support and their cooperation. To thank all the fellows of the college, sister colleges, and other participants that have joined us. Thank you so much. We are expecting your feedback. There's always room for improvement. So suggestions will be entertained to improve in the subsequent webinar. The next webinar, excuse me, will be taken by the Faculty of Dental Surgery. The topic is the systemic burden of gum diseases, implications for chronic illness, and it will be taken by Professor Eso Mato on Wednesday, 27th May 2026. You will receive further presentation, and I can promise you it's going to be another exciting experience. Thank you very much for all your presence. Thank you once again, Faculty Chair Anaesthesia, for your cooperation. Have a restful evening. Thank you. Over to you, Faculty Chair, sir.
Thank you very much, Chairman, sir. Thank you very much. Please, can I call on the college registrar to give his closing remarks, please? Closing remarks by the college registrar.
Thank you, my faculty chair. Yes, good evening. Thank you, my faculty chair. Thank you, college president, principal officers, distinguished chairmen, secretaries of faculties, and our distinguished fellows of the college. Without going ahead to thank the speaker again, Professor Obashina Ogunbiyi, MNI, I want to say that was a highly informative and interesting lecture. Yeah, the lecture is telling us that the future is here.
Yes, it's here with us.
And that we must plan to adapt irrespective of our specialties.
Yes.
When Professor Obashina Ogunbiyi was in school, I doubt whether he could have predicted that he could give a lecture in Ibadan and people will see and hear him all over the globe. that tells us that anything is possible. And what he has said today, I'm very sure in a few years' time, that will be the norm.
College.
So, thank you very much, sir. He also told us as a college to develop guidelines for the use of AI in clinical practice. We will do that.
Thank you, sir.
He's also informed us that we should develop something on the ethics of the AI. Various specialties will go ahead, we will embrace that, and we'll do that. And I hope that I and the DRCAM will make the next series better. Please bear with us, whatever the issues that we have with today's program. And I want to say that if you cannot click on the feedback link, please send it to us through WhatsApp. Thank you very much. Thank you, sir.
Thank you very much. Please, for note, please, can we use another forum instead of using Google Link? Because it has maximum of 100. Yeah. Please, maybe we can, next time we can go to Zoom, which has higher.
We'll address that.
Please, let's work towards that. Because so many people are complaining that they couldn't go in because it was already... yes, please. Let's make a better one. Yes.
We will do that. We'll address that next time. I think they depended on YouTube and they had problem with the YouTube.
And unfortunately, the YouTube did not work.
Yes.
So thank you, my college president, sir.
Thank you, sir.
I think I've done my assignment given to me.
Thank you so much.
Yes, thank you very much.
And thank you so much, Professor Ogunbiyi, MNI. Thank you so much.
Thank you very much, sir. My president.
So
congratulations.
Thank you so much.
Congratulations,
my dear wife. Thank you. Thank you for your support.
Well done, my dear.
Thank you.
Amen.
Yes. Thank you, sir. Thank you
so much. Thank you, sir.
Thank you.
Bye-bye.
Bye-bye.
Thank you, sir. Bye-bye.
Thank you.
Thank you, sir.
Thank you.
Thank you very much.
Thank you, sir.
Thank you very much, sir.
Thank you, sir.
Dr. Lawal,
thank you, sir.
Thank you.
Thank you, Daddy. Thank you, sir.
Thank you, Dr. Matthew. Thank you very much.
Thank you very much, sir.
Thank you.
Thank you, sir.
Thank you, sir.
God bless you all.
Thank you, sir.
Tayo Shoyemi, thank you. God bless you. Yes.
Thank you, sir.
Thank you all. I appreciate you.
Thank you very much, sir.
Thank you, Dr. Duku. I appreciate you. God bless you.
Thank you.
Thank you.
Thank you very much. I appreciate you. Thank you all for your support. God bless us all.
Sorry,
Thank you, sir.
Oh.